to your PPE for OSCA. This is gentamicin administration using a pump and priming a burette. Just keep in mind all the components don't have to be done in exactly the same order, but there are some components that have to be done, otherwise you will be given an automatic fail. You need to do 1 validation, 2 patient checks and 3 drug checks, including allergies. Thank you. Okay, James Lockyer, today's date. He's had an IDC inserted, so we're going to give him a stat dose of gentamicin. So we'll need to give that to that now. It's been given in 100 mils over 1 hour. Yep. Oh, and he wants the IV fluids commenced as well. So if he's going to commence the IV fluids, I might as well use a burette, put the 100 mils that I'm going to give my gentamicin in the burette and give it that way. Then after I've done that, I will recommence the IV infusion at the rate that's on the IV fluid order. Okay, all right. Normal saline. Yep, there's your, okay, so it's 500 mils, but I'm going to put in 100 mils, and there's the order. Okay, I'm going to go to my patient. Good morning, Mr. Lockyer. How are you today? I'm Debbie, the student nurse looking after you. Okay, your notes say that you need some antibiotics because we put in an IDC. So I just want to confirm that these are your orders and that you're the correct patient. So what was your name?
James Lockyer.
James Lockyer. Let me just check both charts. James Lockyer. Yes, and your date of birth?
1st of the 3rd, 45.
Yep, 1st of the 3rd, 45. And your MRN? 895-684-689. Yep. Okay, they match. Excellent. And do you have any allergies, James?
No.
Okay, I'm just going to go and prepare your antibiotic and I'll be back. Here's your buzzer. If you need anything, just give me a yell. Thank you. Alright, I'm just going to look up my drug in the MIMS and make sure that it's compatible and everything's okay with that. So here's my book. So here's my MIMS, gentamicin for UTIs, yes. Precautions, adverse effect, nephrotoxicity, allergic reaction. Yep, so we can't give it too fast, that's why we'll give it in 100 mils. Yep, good. And the dose is correct. Yep, good. And is it compatible with the normal saline? Look at the IV injectable book. Yes, it's compatible with normal saline. Okay, no worries. I'm just going to do a validation of my drugs, please, so you'll be able to help me with that. Okay, so I just want to do validation of both my drugs, so the normal saline and the gentamicin. So here we have Mr. Lockyer. His date of birth is 1st of 3rd, 45, 895-689, and I've checked that with him and he has no allergies, so that's all correct. Biodata is correct. It's today's date, it's normal saline. We're giving 500 mils over 4 hours. However, in the patient notes it states I'm putting it at 100 mils and giving it over 1 hour. So I'm going to check this fluid that's been hung as well as the fluid that I'm going to be giving the patient the antibiotic in. Signed and printed by the doctor, it's legible, it's within 7 days, hasn't been given in its IV. And then I'll just get you to check this gentamicin. I have the same patient, James Lockyer. James Lockyer, 1st of 3rd, 45, same MRN, which I've checked with the patient, and he has no known allergies. I'm going to give him a stat dose, which means now, of gentamicin, today's date, IV, 80 milligrams right now. Doctor's signed and printed, and it's all legible. Hasn't been given, and it's within 7 days. You happy with that? Thank you. Okay, I'm just going to go and collect all my gear. Thank you. Wash your hands again. Collected all my gear. Okay, I'm going to do my first drug check. Would you be able to help me with my first drug check? Okay, I'll check the gentamicin. Okay, I have, my biodata is correct, it's James Lockyer. I've checked his MRN and his date of birth, 1st of 3rd, 45. He has no known allergies. I'm going to be giving him this gentamicin. Here we have gentamicin. Today's date, gentamicin 80 milligrams in 2 mils, so we'll draw up the whole 2 mils. It's given IVI. The expiry date on this one is 2019. Signed and printed by the doctor, hasn't been given, and it's IV. And then I also have this normal saline, 500 mils. Same biodata, 895-689, 1st of 3rd, 45. He has no known allergies. Today's date, normal saline or sodium chloride, same product, 500 mils, 500 mils. Once I've given my gentamicin in the 100 mils over the hour, I'll be running it at 4th hourly rate. Signed and printed by the doctor, hasn't been given, it's IV, expiry date's 2018. Okie dokie. So now I'm going to do my maths calculations. Okay. Thank you. Okay, so I'm going to give, the order is for 80 milligrams. 80 milligrams. Strength required over strength in stock, which is 80 milligrams. 2 mils equals 2 mils I'm going to draw up, or 1 vial. The rate, so it's going in 100 mils. Yep, 100 mils over 1 hour equals 100 mils per hour. And then my concentration for my label is 80 milligrams divided by 100 mils equals 0.08 milligrams per mil. They're my 3 calculations. Okay. Now I'll just get you to do my second drug check. Okie doke. I have James Lockyer, 1st of the 3rd 45. MRN is correct. 72 Dry Avenue, Somersville. I've checked that with the patient. That's all correct, and he has no known allergies. No known allergies. I'm going to give him gentamicin, 80 milligrams in 2 mils, 80 milligrams, so I'm going to draw up the whole 2 mils. I'm going to give that to him now, because it's stat, today's date, signed and printed by the doctor, hasn't been given. I'm going to mix it in this drug, which is still James Lockyer's chart. Date of birth's correct, 1st of the 3rd 45, MRN's correct, 72 Dry Avenue, Somersville, again no allergies. So we have today's date, normal saline, 500 mils, 500 mils. The duration after I've given the 1 hour dose will be 4th hourly. And I've worked out for the 1 hour dose, I'm going to give it at 100 mils per hour. I'm going to use a pump so that it doesn't go through too fast, because there are side effects that could affect him if it goes through too fast. It's signed and printed by the doctor. It hasn't been given, and it's an IV order. Expiry date is 2018. Okay, now I'm going to just draw up my drug. Okay, so gentamicin. I'm going to draw it up using this pink needle, and then I'm going to put a second pink needle on it, just while I prime it on. Because we can't recap needles. 2 mils, beautiful. Taking that off. To keep it aseptic. Okie doke. Alright, I'm going to prime my line. I'm going to do that over here. Resting. I'm going to put the clamp down here rather than on the top, otherwise it will leak. And then my line's ready to go. Line it up. Now my order states I need 100 mils, so I'm going to put in approximately 100 mils, but then I'll top that up when I put in my antibiotic. If I want it to go quicker, I can squeeze it. And I'm going to prime my line. My chamber's half full. Okay. Okay. My line's now primed. Oh, I've tangled it. So I'll untangle it without touching the top, so then it will still be aseptic. There we go. Put it in here. Okay, I'm just going to write my label before I put my medication in. I'll just do my third and final check, and then I'll go back to the patient, put the antibiotic in. Okay, here I have Mr. James Lockyer, 72 Dry Avenue, Somerville, first at 3:45, that's his MRN. I've checked with him and he has no known allergies. I'll do them singly. I have Gentamicin, 80 milligrams, which I worked out was going to go is 2 mils. I'll just get you to check that for me. 2 mils. Yep. It's IVI, which I'm going to put into the 100 ml bag. It's signed and dated by the doctor. Hasn't been given. It's IV and the expiry date's 2019. The other drug I want you to check with me is the fluid it's going into. I have still James Lockyer, first of the 3:45, 895684. There's his known allergies, and I've checked with him. So his biodata is correct. Here I have normal saline or sodium chloride, which is the same thing. 0.9%, 500 mils, 500 mils. I'm going to give it over 1 hour in 100 and 100 mils, which I'll just get you to check that 100 mils. It's a little bit short because I'm going to put my drug into there. Yep, so 100 mils. And that rate, I'm going to give 100 mils per hour. Yep, his expiry date is 10th month 2018. It's to be given IV, hasn't been given, and it's today's date. So that's my third drug check. Okay, now I'm just going to go to my patient, check the second patient check, and then put the drug in, check his cannula site, and then can start it. Just wash my hands before I do that because I've left the patient area. Okay, Mr. Lockyer, I'm back. I'm about to start your antibiotic. Tell me, what was your name?
James Lockyer.
James Lockyer, and your date of birth?
First the 3:45.
First the 3:45, yes, and I'll just check your MRN. 8, 9, okay, they're all correct. Do you have any allergies, James?
No.
No. I'm just about to start your gentamicin. It's got a few different things. We're putting it through a pump so that you don't have any adverse side effects, but you might feel a little bit nausea and get a funny taste in your mouth. So let us know if that happens. Okay, I'm just going to put my drug into the burette. So I'm going to unscrew. I'm going to screw. Put it in. Give it a shake. Now that it's in, I'm going to put the label on, which you've checked. Okay, label's on. Okay, now I'm just going to check his cannula site. How long has your cannula been in, James? Your notes say less than 3 days, yeah? Is it painful? Not painful? There's no redness, there's no swelling. That looks good. Excellent. Okay, I'm just going to give it a bit of a clean before I connect. Okay, 15 seconds. Excellent. That's not hurting, is it? No, good. Okie doke. All right, I'm going to turn on my pump. Okay. Green to green, blue to blue. Beautiful. Okay, 100 mils. And 100 mils an hour, which I calculated. I'll just get you to check my pump for me. 100 mils, going over 100 mils an hour, and then I'll change it to the rate that's on the IV fluid. Okay, now I'm going to connect. Okie doke. Okay, now I'm going to start. Excellent. Now I'm going to clean up and do my paperwork. My drug, so I've given it and it's 11 o'clock. I'll just get you to co-sign that. And also the normal saline, I'll sign it, 11 o'clock. And I also forgot to get you to sign my label. Could you sign my label for me? But you have checked it. So.
Yeah.
I'm just going to do my fluid balance chart. Today's date, normal saline. Today's time is 11 o'clock. Thank you.